Hello and welcome. This is Dr. Paola. I'm here to give you some tips for the AMC Clinical exam, and we will be looking at critical errors that you need to avoid. This is all based in the handbook of clinical examination. When a lady is coming for contraceptive advice, if she is young and wants to go on the pill, very important to always check the absolute and relative contraindications. And if a lady does consult to you because she wants to have tubal ligation but she's close to menopause, this is not in the handbook, but I would say please check first that she's not already perimenopausal, and also discuss with her other alternatives, like without the risk of having a surgery. Before prescribing any anti-contraception, you need to exclude pregnancy. So be safe and always do a pregnancy test. If you see a pregnant lady that is coming to antenatal care and has a history or diagnosis of anemia, it's a failure to provide if you don't provide a provisional diagnosis of iron deficiency, because her history is usually multiple pregnancies in short time and also vegan diet or something like that. It's also a failure not to give her some oral supplements or to say that you will need to transfuse her now. Always ask for additional investigations and all the ferritin and iron studies to exclude that there is no thalassemia or anything else underneath, but treat for oral with oral iron for iron deficiency anemia in the meantime. Young women present with vaginal bleeding after a period of amenorrhea. You need to confirm or exclude pregnancy, so always organize that. If pregnancy is suspected, you need to organize an ultrasound to check viability of the pregnancy. And also always check the groups, the mom's blood group, because in case of negative, you do need to organize anti-D. Pregnant lady, third trimester, positive for Streptococcus B, group B. It's an error not to advise the significance of having this infection, and also will be an error not to start antibiotics if she starts labor or ruptured membranes at any point. If a lady comes with you pregnant, antenatal care, and the fundal height is greater than expected, it will be a failure not to discuss all the positive or the possible causes, including polyhydramnios and why this could be present in this pregnancy, and also a error not to organize investigations, including to measure the amniotic fluid, ultrasound, and also refer for high-risk pregnancy within few days. If you have a case of a postpartum bleeding and you're talking to the midwife or to a junior doctor on the phone, it's a failure not to check vital signs. You want to check how is the patient, the pneumonica is stable, and ask to have all those bleedings and monitor the patient closely. You also, it's a failure not to consider that the most possible cause is uterine atony, and you do need to keep instructions and tell them what is the initial management to control this. So massage of the uterus and checking that there is no other point that is bleeding along the vaginal canal or the vulva. When you have a woman 50 years old or more, usually postmenopausal, complaining about urinary incontinence, it will be an error not to organize a sample of urine and culture to check that she doesn't have a UTI. If a mom comes to you because she is concerned there's a developmental delay in the child, it will be a failure not to organize appropriate hearing and vision test. If an infant comes to you with high fever and there is no apparent cause, it will be a failure not to admit to hospital. You need to organize all the septic screening and discuss the investigations that you are ordering and why. You are trying to find the focus of infection, and it will be an error not to start antibiotics. Remember always to call for the specialist. You are the junior doctor and there's always someone higher in the team that can advise and see the patient as well. So you are never alone. If you are seeing an infant or newborn with fractures or burns, signs of bruises, red cheeks, it will be a failure not to think and consider non-accidental injury. Remember, there are some causes of case abuse, like cases of child abuse in the exam, and you need to keep that in mind and also get history and check for social circumstances about the child and the family. If you are diagnosing diabetes in a young kid, it's a failure not to discuss about management, the positive signs and symptoms that the kid can experience if he has hypoglycemia attack, and you also need to know how to prevent it. If you see a child with a febrile convulsion, which is the most common presentation in exam, it will be a failure to indicate that he has epilepsy. You cannot make a diagnosis based on an 8 minutes consultation. When you're suspecting a case has to do anything with mental health or psychiatric, it will be an error not to offer confidentiality at the start of the conversation. Also, investigate all the lifestyle factors, especially risk of alcohol consumption, drugs, and also ask for patients about self-harm risk. If you get a kid that has a rash after taking antibiotics and those were ordered because of sore throat, it will be a failure not to consider the mononucleosis, Epstein-Barr virus. It will be a failure to indicate straight away that the kid is allergic to the antibiotic. So make sure you get full history and also keep in mind that mononucleosis and the other positive findings in the examination, hepatosplenomegaly and large nodes in different parts of the body. If patient is coming for nausea, headache, jittering, any tremors, or possible side effects of a medication, it's always very important to check past medical history and in all cases ask the medication that they are taking, because that may be the reason why they are presenting with those symptoms. For those patients complaining of insomnia, do not start medication straight away. Always start with sleep hygiene, checking the lifestyle, managing stress, and organizing CBT and talk therapy. There's many cases in the exam about acute confusion state or delirium. It will be a failure to indicate that the patient has dementia. So beware of all the possible causes of delirium and check what is positive in this case, or at least say that you were going to investigate, but most likely it's a self-limited condition when you know the cause. In any case that the presentation is headache, always check blood pressure, endoscopy, and if there's any past medical history of migraines or other conditions. Whenever you are examining a joint because patient complains of pain, remember this pain can be referred. So always say at the end, to complete my examination, I would like to examine the joint above and below this one, and always compare to both sides. When you get a man complaining of dysuria and urinary frequency, always exclude a urinary tract infection and organize a urine culture. Check health, sexual history, and also do a random blood sugar just to confirm he's not diabetic. These are some of the most common cases from the last 2 years records that relate to critical errors listed in the AMC handbook. Apart from this, I would say that will be a failure not to be able to read a ECG, recognize atrial fibrillation, or any sinus tachycardia, and also myocardial infarction. It will be a failure not to know how to recognize a pneumothorax in an X-ray, and also signs of COPD or a lung cancer if there's a mass, or pleural effusion. It will be also a failure not to know how to do an abdominal X-ray for a obstruction, intestinal obstruction, or ileum. It will be a failure not to know how to read and interpret a spirometry. So those are the main tests that you would like to check. The last couple of things is very common sense, but remember always when you're doing a physical examination to explain what you're going to examine, to get the patient ready, expose, ask them to empty the bladder if they need, expose the limbs if you're going to examine them. Always wash your hands before and after. Always wear gloves if it's an accident, and of course if you're doing any genital examination, rectal examination, pelvic examination. Always, yes, get consent before starting and get a chaperone if it's appropriate. Finally, for psychiatric cases or medicine cases that you are not interviewing the patient but a relative, always check that they have the medical authority to talk on behalf of the patient. I hope that you find this useful. As always, I am on Facebook, AMC Summaries, and I have a great compilation of resources. Complete Summaries is the name of my self-study course. Lots of material all in one place, just waiting for you to come with the desire to study and follow a plan. Any inquiries, please email me. Bye for now.